Welcome to Mental Health First Aid. We're going to talk today about mental health in seniors. Is there a difference? Do seniors have a area of mental health problems that we don't, the general population does? Or is it part of the general population? That's what we want to talk about today, and we have a couple of specialists here today from Linden Oaks and from Alden at Waterford. We have Anna Johnson here, and we have from Alden, yes. And we have Robin Lee Garber from Linden Oaks. Got those names out, got it done. So let's talk, Robin Lee, you have a lot of background. Let's hear some of the things that you have in your background, what you do.
Well, I started out a long time ago as an artist activist, and that is to
Interesting.
say, yes, I graduated with a 4-year degree in art, and started doing things like the Anti-Graffiti Network in Philadelphia, working in a lot of community places, and just teaching art. And I decided that I wanted to go for a master's in art therapy, which I completed at UIC, University of Illinois at Chicago, in the early 90s, and then started working in different agencies, non-for-profits, and hospitals, and community-type settings.
Mm-hmm.
Eventually, ending up at Linden Oaks, I was interested in working with the geriatric population. And my role there is actually a licensed clinical professional counselor. I'm a clinical therapist. That's my hospital title. But
it's your hospital gig?
That's my hospital gig, exactly. And then what I have done over the years I've been there since 2005, I have woven into what I do an expressive therapies component where we do music in the afternoon. And a few years ago, we brought in the amazing, famous Dr. Linda Levine-Madori to train our entire staff in the TAP method. TAP stands for Therapeutic Thematic Arts Programming.
You have mentioned about 5 other shows we can do.
I know.
Music therapy, TAP, we have all kinds of stuff we can do.
All that stuff, but yeah. It's all important on our unit. We are very much activity arts based. Mm-hmm. And we find, especially with dementia care, that one of the first things to go is one's ability to speak, one's ability to use language. So we have found that art and music and nonverbal type activities, mm-hmm. sensory processing type mm-hmm. engagement is really the best way to work.
And we brought you guys together. You guys are friends. You worked together before and you know each other. Yeah. Anna, can you give me some background on you?
Sure. I started out as a board-certified music therapist working in an inpatient hospital setting with adolescents and adults, and from there moved into working in a community hospital and started working with our skilled unit, which is more of a geriatric population. Wound up being what I called farmed out to a nursing home down further south providing music therapy consultation services. And during that period of time, this particular nursing home opened up a specialized dementia unit. Mm-hmm. And I was a part of that opening, and it was during that time that I just developed this love of working with people with Alzheimer's and dementia. And as a music therapist, oh my gosh, what Robin Lee was just talking about mm-hmm. just zinged me in the heart, because here are these people who could no longer speak, but they knew every word to every song and every hymn. And when the ability to sing it went, they were still keeping rhythm, and it was just so powerful.
And this is tuned to seniors more, I mean, or does it for everybody?
Music therapy and art therapy is for everybody.
But it really clicks with seniors.
It really does in this kind of setting. And so I then kind of moved from being in a hospital setting to long-term care, working as the manager of dementia units.
MBA.
And then became a licensed nursing home administrator. I really wanted to have a broader ability to impact how care was delivered. Mm-hmm. And most recently I did get my MBA in Health Systems Administration. So. And am now the executive director at Alden of Waterford, And this is strictly for dementia care. It's an entire facility. That's all we do is care for people with Alzheimer's and dementia.
And I was telling Robin Lee, we have like 5 different shows
yeah.
with you guys. And I'm going to have you guys back on, especially for the music therapy and talking about that. And in fact, at the end of the show, we're going to do a little bit of, you guys do a little song for us.
Yeah.
At the end, and we appreciate that. And give them a little taste when we go through for the full show as we go through. But seniors, it's sort of interesting. We talk about seniors several times. And it's really almost when you're talking about you found your calling.
Yeah.
You know, that's so cool when you say, wow, this is it. This is, you know, I tell you, I've been in my 30th classroom reunion, and they still don't know what they want to do when they grow up. You know, when you can find that and find that niche and go, wow, this is it, you know, it's really exciting. With seniors, who is a senior? There's so much different things with seniors. I mean, legally and McDonald's seniors and, you know, ARP seniors and, you know, what is a senior? What age?
Well, for us, it gets translated into who do we admit, and our youngest cutoff is at 55.
So we have young seniors and
seniors? We have young
seniors?
seniors, and then we have seniors, and that's all dependent on what's going on.
So 55.
55-ish.
And I know ARP, it's 50. Right, that's what we were talking about. I'm a member, so got there. But what is it with? Is it Linden Oaks a specialty for seniors, or is there a number?
Well, we have a special geropsych unit where we take people ages 50 and up. Sometimes we take people who are younger who are having, such as Alzheimer's early onset. Sometimes we have people in their 40s who have had strokes and whatnot who would qualify for that level of care, need that kind of intervention with them because of dementia or stroke.
So it's not really an age thing, it's a disease thing or an illness thing that will bring them into it because they sort of fit in that realm.
Right.
Of going through there. Very interesting. I mean, because like we said, McDonald's, what they say is a senior or whoever else says a senior for discounts or for that, we don't know what it is.
Right.
Legally, there's different things considered senior too. So, but we're just going to include them all. Like, when we have classes and it says we're seniors, they say, well, can I come into this? Am I a senior? It says, hey, if you think you're a senior, come on in.
Yeah.
Works for me. I don't
good.
care. I don't keep a line on it because it's however you feel and what you feel you are. And we don't. I don't see senior as a derogatory term. I see it as a wisdom term. I see it as a entitlement. You know what I mean? It's not it's not something that's bad. It's like, I made it. All right, I'm there and I'm going to have some fun. So we want to talk a little bit more with the different issues. When we talked about in the beginning about mental health, are the seniors, do they have it like cornered for certain things where there are mental health issues, or is it across the board? Depression, anxiety, as an example. Both of you guys are clinicians.
Yeah.
You got information on this?
Well, there's this statistic that says that, as generally population as a whole, older people are less depressed than younger people. Only because they've gone through so much in life, and they've problem solved and the wisdom, and they've developed coping skills, whereas really younger people are, have a tendency, or I think, are greater at risk to be more depressed than older people.
What about anxiety? Anything with that?
Yeah. I see a lot of anxiety in our practice and in long-term care, and so much of that has to do with, here's this new situation, here's this new set of health challenges, and this new setting now that I need to live in. And the expectations are different, and the schedule is different, and the people are different. And admitting sometimes that there was a problem that we need care for is very anxiety producing.
A life change.
And so we do see a lot of anxiety, but I have to say that while that's true for our seniors, that's very true for our family members that are coping. And
the
so
general population.
It's a general problem.
Right, right. I tell you what, when we come back, we're going to talk about this a little bit further and talk about the anxiety issues and maybe what triggers it with our seniors and some other issues with that about our seniors. And we'll be back in a minute.
Big dreams and good grades aren't enough to get into college. There are actual steps you need to take. Finding someone who can help is the first and most important. For the next steps, go to knowhowtogo.org.
It begins innocently enough. You don't return a phone call. You break a date at the last minute. But in fact, it's the beginning of a pattern. And soon, your friend with mental illness realizes you're avoiding them. But what if you knew that your friendship was the key to their recovery? Would you still lock them out of your life?
Welcome back to Mental Health First Aid. We're talking about our seniors and mental health, and if there's differences. Are there differences between seniors, general population, or are they pretty much the same? And we have a couple of people here talking with us, and we were talking about the triggers, maybe of anxiety. And Anna, you were bringing up some things about anxiety from possibly moving into a facility, a different location, a different plateau of life, basically, of what they're doing. And not necessarily a bad thing. It can be exciting, it can be very interesting, but it can be very strange and different for them too. Is that a trigger that you were talking about that could be?
Yeah, that's right. And we see it at our level in long-term care, and I know that Robin Lee, you see this in your practice. And the inpatient side is that people as seniors are moving into different stages of life. They've retired, perhaps. Children have moved on. Things have changed. Now the question is every day, what do I do with myself? And not knowing or having the sense that something is wrong, say if Alzheimer's is beginning to set in and there's a sense that something is wrong, but we don't know what it is. And we know that we're not doing some things right, but that's a horrible thing to admit. And so covering that up and trying to compensate for that creates a lot of anxiety, because how do you handle that? How do you hide it? How do you function? And so anxiety can really become a problem at that point, especially when we haven't identified yet what other medical things may be going on with that person, or we haven't identified what can this person do now in this stage of life that gives them meaning.
You know, it's really different how each person's different, totally. They're built different, the ideas and genetically how we're made, the whole works. I've got several senior friends in their 70s, and one having a real hard time getting through because he can't show that life is right because he's not accomplishing things as he goes through, like he did in his job. Now I have other senior buddy, close friend, who totally retired when he was 30. You know what I mean? Life is a great time, and boy, what a different outlook.
Yeah.
Same exact ages, in fact, friends, but totally different. One's got anxiety sort of on the mind a lot, you know, of things, and the other one is, hey, where are we going to go camp out next? Where are we going to do this? Where are we going to do that? You know, let's go do constantly on the go. Yeah. It's just different how everybody's built differently with it. When we're talking about anxiety, and we talked about one of our other shows about how we interview people, assess them, referrals, that kind of thing. And through the assessment process for seniors, what would that look like for seniors at Linden Oaks?
Generally, people can come in for a free assessment at any time, just to kind of, you know, talk about. A lot of times kids bring, you know, adult kids, I should say, bring their parents in. If they start to see that there's some changes, that they are more anxious or more depressed, that they're no longer doing what they used to enjoy at home.
Right.
Maybe their sleep is off, maybe they've stopped eating. The other piece is we often get people who come over from Edward Hospital or from nursing homes, assisted living. Sometimes people have been picked up by senior services, the police, and so forth.
Right.
People come in for numerous reasons. One thing I do have to say about our program that people are often surprised about is our unit, even though we're part of Linden Oaks, the behavioral health facility, most of my patients have no history of mental health issues. What happens a lot is people may have had a heart attack or a stroke.
Right.
Maybe they're cancer survivors, autoimmune disease, something medical occurred.
And through a depression screening or something would come up,
and you can become clinically depressed later on in life because you've had a medical trauma. A lot of people don't know that, and they see it as a sign of weakness, or there's, you know, suddenly, now I'm crazy, now I'm psychotic. It's really not the case. And when they come onto our unit and they see that it's more of a sort of like a cafe style setting, our hospital, you get to go outside. We have a beautiful courtyard. When the weather's nice, we don't have them building snowmen or igloos or you know, raking leaves or anything in the courtyard, but it's lovely. And it's a very gentle place. It's a place for healing, not so much a place where we're going to give you tons of medication and.
Well, with your music therapy, we're talking about. I hear rave reviews about your music that you do there. On a daily basis.
From 2:30 to 3:30, that's we designate that as, you know, what some people call the sundowning times, where people start to become more restless or agitated. Or even just for our generations group, the people who don't have dementia, but they're 50 and above, people get stressed out, they get more anxious in the afternoon. So at about 2:30 in the afternoon, they've dubbed it the Frank Sinatra Hootenanny. You know, I'll get out my guitar, I bring out instruments if people are up for it. I have an accordion stashed in the break room. You know, occasionally we'll rip out a polka here and there. But we'll sing, and the staff get involved when they're not, you know, terribly busy. And it's a lot of fun. It builds community. It's relaxing. We serve tea. You know, I'm like half performer, half waitress. You know, it's part of our hydration protocol that we do. And it's a lot of fun. And we really try to take the sense of, you know, you're in a mental health facility down to you're in a place to get well. You're in a place of healing. And it's
try to dump that stigma.
We really we really focus on that, and our staff. I've been working with people who have been there since 2003 when the unit first opened. We all love working with this particular population. To be transferred is not something to another unit. It's like, please don't send me to adolescent. You know, no offense, but
it's what you're into.
But we have a really great time and singing the old songs. And earlier in the day, we do a lot with artwork, and it's really nice.
Ties it all together. With Linden Oaks, how long will they usually stay?
Average length of stay is about 7 to 10 days. That's the other thing too. People think, I'm going to be here for months at a time, and it's really not the case. Our goal is to immediately start talking about, well, discharge plans. You want to go back home. Sometimes a person's at the point where we need to start looking at long-term care, dementia care, like at Alden Courts of Waterford. Sometimes they need just a little extra help from senior services.
And that's where our partnership comes into place, where we have partners with lots of different agencies and stuff, and you with us. I mean, if you're having problems, you send them to us to get them back on track, to help them, get them healthy again, psychologically healthy all the way across, then possibly go back and forth, whatever happens with it.
And we're really lucky. I mean, Linden Oaks is situated in a place where we are surrounded by so many good facilities, Alden Courts of Waterford being one of them, that are activities-based and really a good place to be. And I know everybody, I think.
You know what, in the beginning also, Alden Courts of Waterford also is a partnership with Mental Health First Aid. One of our partners put right on there, so it's a entity that really gives back. And that's what we're trying to do with Mental Health First Aid, is give back to the community. You know, and everybody's been working together, and it's working out really nice. If one of the classes, if there's in fact, we're going to have a class at your facility.
Coming up in November.
Yeah, we have that, and it's for anybody across the board. It's for seniors, to try to help fellow seniors out. So it's something that really is there to help out across the board. We're talking about dementia, memory loss. What other things?
Well, if I could say about dementia is that even though we sometimes have to treat that in the realm of mental health, dementia and Alzheimer's is not really a mental illness. These are medical illnesses, and unfortunately they have an impact on behavior, and sometimes they can impact mental health in a way that there is psychosis and depression that goes along with it, but it's a medical illness.
So there's a clinical end to that.
Yeah.
I tell you what, let's talk about that when we get back. We're going to talk more about the clinical end of this, and maybe not diagnose, but just look into different illnesses and try to figure them out, triggers, and how to recognize them. We'll be right back.
Everyone has friends. There's online friends. Friends to go out with on a Saturday night. Friends to hang out with and do nothing. Friends who show up on moving day. And then there are the friends who'll be there if someone is dealing with a mental illness. Are you one of those friends?
I remember how much you said you liked wine.
Oh.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
Welcome back to Mental Health First Aid. We're talking about mental health in seniors, the difference, and maybe some triggers to look at, some clues where our seniors are with possible mental health problems. But we've also learned that they're pretty much general population, we have the same issues going on. 1 out of 4 of us have a mental health problem, and our seniors are included. And we're talking right now about Alzheimer's, and discussing a little bit. Triggers, ideas, is there anything that we can look at that say, oh, maybe there's something here, maybe we need to see our physician? Maybe, is there a checklist?
Well, there is kind of. And if I could recommend a book very, very highly,
Absolutely.
It is the Alzheimer's Action Plan by Dr. Doris Swamy. And it does give you some checklists and some things to do and some things to look for. And it's very thorough and it's very reader friendly. And it's great. And Robin Lee and I have heard him speak, and what a tremendous mind and how he presents that to families.
Right.
So I would recommend going through that in detail. But just in general, you know, when you start to notice memory changes in a loved one or yourself, you need to see your physician, because sometimes memory changes are a symptom of something else medically going on. And so the first step is going to be a complete physical and lab work, and to make sure that we're not missing something medical that's only showing up as a memory problem.
And it doesn't have to be the worst
No.
thing. I mean, it could be a urinary tract infection.
Yeah.
You know, it could be something like that. It doesn't have to be the worst prognosis that you
know,
think.
we see tremendous changes in memory and in mood and in becoming aggressive and combative with our seniors when they have a urinary tract infection. The body doesn't give them sometimes the other signals that you and I would get as younger people. And so our first symptom, our first clue sometimes is the change in behavior. So be really on the lookout for that. Any kind of infection, it doesn't have to be urinary tract,
Right.
Any kind of acute infection can really affect someone who is elderly and affect their level of awareness, affect their ability to function cognitively. If it's not dementia, if it's not Alzheimer's disease, when we clear up that infection, we're going to see a huge improvement cognitively. If that infection clears and we get everything else taken care of, we still have the memory problems, we still have the cognitive decline. Now we're looking at something that is either related to another disease process that has caused the dementia, or we're looking at, does this fit the picture of Alzheimer's disease?
Let's look a little closer at the memory. You say memory loss. I mean, I can't find my keys. We're not talking that. We're talking something.
No, because I'd have to check in about every other day in my own facility if that
We're
were
talking.
the case.
What are keys?
Okay.
What are keys?
Right.
Yeah.
What's a chair? What's word finding problems? You are losing the ability to name things, to, you know, just to forget here and there. Sometimes everyday stress can be a factor where your memory is not as good, but it's the quality of the memory.
I think that's a perfect example of what you just said. Not, you know, where did I put my keys? What are keys? That's explain it perfectly to me. When you said that, I go, oh, that's a totally different level, you know, what we're talking about. So when an idea is that memory loss, and then it can go into dementia, then it can go into Alzheimer's, or is it usually separate things?
Well, Alzheimer's disease is a form of dementia. Dementia is the bigger
Under the
umbrella.
Mm-hmm.
And Alzheimer's disease is probably the most common cause. But you can have dementia related to the progression of Parkinson's disease, of Lewy body disease, of some other, Huntington's chorea. So there's other things, vascular dementia for people with diabetes and heart disease,
Right.
because as the brain is losing oxygen, as the brain is not getting enough blood flow.
The same type of memory loss? Like
No.
you said, the key...
My father-in-law has dementia, and for the longest time, my mother-in-law refused to acknowledge any of his behaviors.
Just that he's forgetting, it's okay.
Well, no, it was
Like he's enabling.
you're doing this on purpose kind
Oh,
of thing.
oh, okay.
And she passed away back in 2006, and shortly thereafter I said, let's get Dad tested.
Mm-hmm.
And we went for an MRI, and sure enough, it had shown signs that he had had TIA, some small strokes in the brain,
Mm-hmm.
which explains why he was acting, you know, so befuddled, couldn't get the words out,
Was
didn't
there
know what to
anything,
do.
if you'd have done that earlier, would it have helped? Or at least help you, I guess, to understand. You know what I mean?
Well, I think, you know, when you're a clinician in your own family, nobody believes you.
Yes, yes, yeah.
So
Yes.
they really,
Yes.
you know, people, my own parents are
Yeah.
suspicious of me. But I think, you know, with him, once we knew what was going on with him, we then were able to put some safety factors in place. We wanted him to continue to live at home until he couldn't anymore.
Now, those things, the small stroke can heal themselves, right? Sometimes.
Sometimes.
If it's small, if it's, and they can go through it, I mean, years later or something, and find a new pathway or whatever. I'm a little familiar with this with my dad also. So, and luckily, you know, he was able to come back totally. That it found a new path and there was no issues there. But if it continues to happen,
Right.
then we have to look at it a little bit closer to try to, and there was medication that was brought on. There were some other things that tried to help get it across. So all these things are sort of under the same umbrella.
Right.
And now you have to decipher which is which and,
Right.
and what's going on.
And that's the big challenge. And if I could, you know, wave a magic wand and solve one problem in this arena for the families that I see, it would be to take away the stigma. Because there's a sense that the demented person is crazy.
Right.
And they're not. They're suffering from a medical disease. And the symptoms are just that. They're symptoms of the disease process. We should not be embarrassed. We should not feel like this is something to cover up, because the earlier we get help, the earlier we get medical intervention, the longer that person can go leading a healthy life. We can minimize the effects of the decline
Right.
with, you know, we only have a few medications, but those that we have are pretty effective right now. And you can give that person quality of life for much longer than ignoring it, being embarrassed of it. They're not acting right. If they're not acting right, find out why. Do that out of love for that person.
You know, when you mentioned that, first thing came into my mind was, it's almost like thinking medieval. You know, like, why are we at that level? We should be past that level now.
Yeah, one of the worst things that I've seen happen is, you know, people start to become more isolative, and they think, you know, stay home, watch TV, don't go out.
Socialization is ended.
You know, I've got this problem, I should just be in the home, it's safe in here. And what we try to convey to our patients is, that's the last thing you want to do. If you're going to live at home, look at adult day programming.
Right.
Look at more activities, activities that allow you to do the things that you like to do, that
Different
are safe.
support groups, different things,
Exactly,
right.
and not just for the person suffering with the dementia, but also for the family too.
And get the help quick. I mean, don't wait. Don't wait that 10 years. Get that help faster, and then you get on the right track.
You will get sicker and become more debilitated faster if you just stay at home and do nothing.
Yeah,
Right.
exactly. Some great advice. I appreciate it. Now we have a little treat. We have a little treat in the store. We're going to do a little music therapy here. And
For you.
Yes, for me. For me. We're going to end our show, our segment today, with a little music, and they're going to sing for us. So thank you for being here, and we will see you next time.
I think this is the universal anthem of music therapy.
We can bring people out of a coma singing this song. Sing along with us. You are my sunshine, my